My name is Montserrat Serra, and I work for DMAS. For those that don't know me, I am the Civil Rights Unit Manager, and we have been putting together these forums in the past. I think it's been since 2013. So every or twice a year in May and in December, the Department of Medical Assistance Services and the Civil Rights Unit organizes a virtual forum so that people, organizations, individuals with limited English proficiency or individuals with accessibility, or that want to find out more about accessibility can join us, and then we can learn from each other. So we have, for today's forum, we have decided to discuss the topic of quality assurance and how organizations ensure translation and interpretation quality. So we thought this was going to be a very good topic. So thank you everyone for joining us. I wanted to give a special thank you to my team, the Civil Rights Unit team. Sarah Cariano, she is our supervisor. She will be sharing some words later on after I share the agenda, but also Jesus Perez, who is the Civil Rights Compliance Specialist. He and Sarah have been helping out with the planning of the forum and the agenda. So I just want to give a few seconds for Jesus. Jesus, if you're here, if you want to say a few words, feel free to join the floor.
Thank you, Montserrat. Can you hear me there?
Yeah, we can hear you.
Oh, hi everyone. My name is Jesus Perez. I am the Civil Rights Compliance Specialist here at DMAS. I am part of Montserrat's team. And only as an introduction, I assist with implementation of our Language and Disability Access Plan. So I hope that all of you enjoy this forum. Montserrat, I will take advantage of this opportunity to tell you that I sent you a message from the live captioner. If you have a chance to take a look at it, because this person is trying to access the event.
Okay, yeah, we have a live captioner. Is she, because are you able to share with her the invite, Jesus, by any chance? Well, I
will work on it. Let me see if I have access to it. Yes.
Yeah, I don't see her like trying to join, because I've seen some that have been trying to join and I can pass them through, but yeah, see if that works. If not, let me know. Feel free to interrupt if she's not able. So while Jesus is trying to get the captionist joined so that she can start with her captions, I wanted to say thank you to everyone that has joined today. You probably have registered for the event and probably have seen some questions that we have. We want to find out more about who joins our events, and also we want to get some ideas on how we can present future information. And I wanted to just take the opportunity to highlight some of the information that you all have shared, because I think it's very helpful, so that we all see how we are working together on this language and disability access piece to make our programs and services more accessible. So some of you have responded that you are joining today because you wanted to learn how other organizations are doing in regards to efforts to language and disability access. Some other person said that they want to get information to support local agencies, or somebody else said how most of their patients are Spanish-speaking families and that they wanted to keep learning about new resources that Virginia has for them, which is great. And this is why we are all here today. Somebody else said how they wanted to gain insight to the process others use for translation and interpretation services. And another person said how they want to learn more about how accessibility has grown and how to improve moving forward. And lastly, I wanted to highlight this comment from somebody who mentioned that the reason why they're here today is because knowledge is power. And I love that. And that's the main reason why we organize these forums twice a year, because we all want to learn from each other. Some of us have participated in other webinars and receive a very good amount of information, but there's always something new that we learn. I speak for myself. I join every webinar that I can in regards language access, and there's always something new that we learn. So with that being said, I hope that today everyone is going to learn something new, and thank you for joining us. So let me move this slide. I want to go through some logistics. Just wanted to make everyone aware that this presentation is being recorded, and then it will be available for viewing later at the DMAS website. We will be sharing the presentation also, because you can see that there are some links that you cannot access right now while viewing the presentation. But know that we will be sharing this presentation with everyone that has registered, and we will also post it on the DMAS side. In the chat, if you feel comfortable sharing your name, your job title or organization, please do so while we are going through the logistics. We find it very helpful for everyone else to see who has joined, and I don't know, I think it's a piece of encouragement to know how many people are here willing to learn more to help with language and disability access. We also wanted to let you know that we have Virginia Relay with remote conference captioning. Is everything good, Jesus, with the captioning?
I just sent the link for the event, and I am waiting to see if it works for the captioner or not. I will keep you posted.
Okay, so we hope this works. There's also automated captioning for those that want to follow the event with the closed captioning that the webinar has. We also have 2 American Sign Language interpreters. We have Ali and Katie. They will be taking turns. Thank you, Ali and Kelly, and Katie, for being here today. And if you experience, if anyone in the audience experience any difficulties, please send us an email to the Civil Rights Coordinator at dmas.virginia.gov email account. Jesus is monitoring that account as well. And if you have any questions during the presentation and at any time, you can put it in the chat. We will not be addressing the questions until the end of the presentation. We usually have enough time to cover some of the questions. If we don't happen to have the time, we will be sharing the answers to your questions if you have put them in the chat.
Montserrat?
Yes.
I just want to inform you that the live captioning is working now. I just copied the link in the chat.
Perfect.
And we have the automated captions and the live captions too. You only have to click in that link.
Excellent, excellent. So yeah, if anybody wants to follow the webinar using web captions, using live captions, as Jesus said, just copy and paste that link into your browser, and you can size your browser to fit as you prefer, so you can follow the captions. All right, so let's go very quickly through the agenda, what we have planned for today. We started with introductions. As mentioned earlier, we will open, or Sarah Cariano, she will do the opening keynote. She's the division director, the eligibility policy and outreach team or unit here at DMAS. We will also have around 1:10 a brief presentation about translation review process. I will be introducing that presentation and performing that presentation because this is a project that we have initiated and completed at DMAS. So I just thought that it would be very helpful for others to know how was our experience with quality assurance, with translations. And then around 1:30, we will have a panel discussion. We will have Khalil Thomas, the language access quality specialist for the city of Philadelphia. He works at the Office of Immigrant Affairs, and we will also have in the panel discussion Cristina Bonilla Barbosa. She's the Language Access Program Manager, Public Access and Innovation for TriMet. So we will have a very interesting discussion around 1:30 about quality assurance and how Khalil and Christina, they have done initiatives at their jobs or their organizations about quality assurance. So I can wait to have that discussion with them to see what else we can learn. And then towards the end, we'll have the quality of, the Q&A. So again, if you have any questions, feel free to put them in the chat, and then we'll have some closing remarks. All right. Well, so without further ado, I wanted to give a very brief presentation to our keynote speaker today. She is Sarah Cariano, and she's the Eligibility Policy and Outreach Division Director at DMAS. She oversees the eligibility policy and also the Civil Rights Unit. Prior to starting this role here at DMAS, Sarah worked at the Virginia Poverty Law Center as the Senior Health Policy Analyst and Deputy Director of the Center for Health Communities. While at the Virginia Poverty Law Center, Sarah helped to grow and manage Enroll Virginia, the Virginia Poverty Law Center's ACA Navigator program, which provides marketplace and Medicaid enrollment assistance, community outreach, and education. So she's an expert in Medicaid. She became an expert before she even joined DMAS. She worked with staff and partners across Virginia to reach vulnerable populations and help them obtain coverage. She also advocated at Virginia's General Assembly to expand coverage options and ensure Medicaid program and other health information is accessible to all Virginians. Sarah completed her undergraduate degree at the University of Richmond and received graduate degrees in social work and public health from Virginia Commonwealth University. She's, again, the supervisor of the Civil Rights Unit, and we are thrilled, Sarah, that you're here today to do your keynote opening. So without further ado, Sarah, if you want to share some words with the audience, the floor is yours.
Thank you so much, Montserrat. I really appreciate that. And I'm so excited to have so many people joining us today. I think I saw even someone from RPS in there, which I love. That's where my kids go to school. So thank you for your participation. And I think maybe Hampton School was in there too. So just really excited to see the diversity of participants kind of coming in and putting where they're working and who they're serving in the chat. Thank you so much for that. Also just want to thank Montserrat and Jesus and the Civil Rights Unit for putting these forums on and doing all the work. And then I just get to come and say a few words and learn from the wonderful panelists that they've lined up. So thank you both for all the effort that you put into to these events. As Montserrat said, the Civil Rights Unit is within the division that I oversee, but they just moved to my division a few months ago. So this is my first forum in this role. I've been to other forums, and I'm just really excited. It's such a great team to work with, and the work that they're doing for the agency, across the agency, coordinating our translations and other accommodations for members for the appeals division is incredibly impactful. So I'm so excited to be here and to be working with them as well. Throughout my career, I spent, a little over a decade at VPLC and doing that enrollment assistance work through the Navigator program, and just the importance of accessibility was ever present, and I learned so much through working with the different stakeholders and different communities that I was able to serve. It was really clear from the beginning that the populations that needed the most assistance with that enrollment piece, with understanding the programs, were folks who had to kind of overcome additional barriers, including language access barriers. And so as our program grew and developed, it really began to serve specific populations that we were able to find and identify as having these additional barriers, and developing programs, developing materials, and fine-tuning them with the community to make sure that what we were working on, what we were providing, really was able to serve all Virginians, not just those who spoke English, or those who went to certain places or listened to certain media. We really strove to reach everyone where they were, and in a manner that they could understand. That was our priority, and I'm just so grateful that here at DMAS that kind of priority continues on through the Civil Rights Unit and the members that we're serving. It's clear that it's so important for folks to be able to read their notices, to understand the applications, understand when something is being asked of them. And all of this is the goal is to help folks get the coverage that they're eligible for, prevent unnecessary denials, case closures, serve the member. But in turn, that also helps us run a more efficient program. We're able to prevent kind of the additional churn and losses, which is always creating more work for eligibility staff as well. So by, serving our members and helping them, making sure we're communicating correctly, it also just helps us run a better program, as, a secondary benefit there. But in that process, we've done a lot of work to provide those. And I think the next step for us as an agency was really kind of kicking off this quality initiative and looking at our translations and how, when we have in-house folks who can review Spanish translations and make sure they're accurate. But when we're looking at languages such as Farsi and Arabic, where we don't have, at least within my little division, native speakers who can really look at the language and make sure that the translations we're getting back from our vendor are accurate and of a high quality. We started to think, and Montserrat and their former manager, John Stamek, started to think through mechanisms that could be used to just kind of bring in that next level of quality, that next level of assurance, to make sure that the communications we're sending out were accurate. And that's really what started this quality initiative that Montserrat is going to share about today. And I love that we are just, continuing to grow and try to improve the services that we're providing to our members. And I'm so excited because the panelists that we have today, they're further along in that process in their roles. They have more experience with the quality assurance. And so I'm just so grateful for them for being here and for sharing with us and helping us learn. And they're the experts. And so I'm going to turn it back over to Montserrat to share about our project, and then get on with the panelists so they can teach us, and just thank you to them as well. We're so excited to have you today.
Excellent. Thank you so much, Sarah, for this wonderful introduction, and thank you for all you do at DMAS, and for making sure that all of the notices and all the communications are accessible to everyone. Thank you so much. All right, so as we explained earlier, I'm just gonna go through the project that we completed here recently within this year at the Department of Medical Assistance Services about the translation review process. So the translation review is the quality assurance step where a trained translator reviews a completed translation to make sure it is accurate, clear, and culturally appropriate. As Sarah mentioned, Jesus and I, and we have also another team member, Teresa, as the Civil Rights Unit, we complete a lot of translations for members. So it was a very important initiative because we received the translations back. So we want to make sure that they are accurate, clear, and culturally appropriate. So it is important to have this step in the process because you want to make sure that you comply with the industry standards and the client requirements. And then once you receive that quality assurance feedback, then you can just implement to improve it for future translation. So it's a very important step in the process. And I thought it was going to be very good information for everyone that does work related to translations and interpretations. I think this is going to be helpful to know. So the slide that we have here is original English paragraph that we translate over and over again. And then we have also the Arabic translation on the slide. Well, we get, as mentioned earlier, we do a lot of translation work. And when we receive the translation, this is what we see. I don't speak or I don't write in Arabic. I'm sure a lot of people in the audience don't read Arabic. So when you see an Arabic written paragraph, you have to trust that you're using an appropriate vendor that is using a qualifying translator to produce this translation. But of course, we just don't know. So that's what we were thinking, okay, we need to add a quality assurance step to make sure that the translations, not because we don't trust our vendor, but just to ensure that we are providing accurate translation. So I thought that this slide represents very well how we feel, and probably how most of you feel when you receive a translation that it's written in a language that you don't necessarily understand. Again, in-house at the Department of Medical Assistance Services, Jesus and I, we speak Spanish, we write in Spanish. So it is wonderful when we get translations in Spanish because we can tell, but when it's in another language, we had that dilemma that we needed to implement a step for quality assurance. So when we do the translation review or experience with this translation review, it's not because we want to catch or critique different translation styles. We don't want to catch maybe somebody is using this word because in Arabic, let's say, because it expressed better for them. Usually when we get involved with quality assurance, we just want to make sure that what we have translated is accurate. If you have experience with translations, you know that linguists have some preferences for certain words that others or certain expressions, and it's not like 100% accuracy translation issue. It's more like we just wanted to make sure that the translation reads well and not paying as much of attention of like the linguist preference. So we wanted to basically identify errors that impact the meaning, the tone, or the usability. So we wanted to make sure that the translations that we have already completed were accurate, were clear, and they have the appropriate cultural fit. So we got a third vendor involved with this translation or quality translation process. So we wanted to have a third person look at the materials that we have already translated and also look at the audio recordings that they were done with interpreting services to make sure that they were accurate. So that it was a good translation and it was a good interpretation. And if not, we wanted to make sure that we know how we can make sure that we improve those services. So the translation review is essential for high-stake content affecting safety, health, or legal compliance. We had to select documents that we wanted to have a review. And when selecting those documents, obviously we have a high volume of translations. We couldn't select all the translations that we have performed so far, but we decided to go and select materials that had more high stakes content, also materials that are more long lasting, like for example, income guidance. Those are type of materials and flyers that we use every year that they are being revised because there's new income guidelines, but we decided to choose this type of materials because we thought they were going to be more relevant for the quality assurance process. Also, complex technical or specialized content materials that require precision. We thought those would be most appropriate for this initiative. And materials that are being used more for vulnerable or underserved populations, or other materials that have more content. These are some ideas on documents that you might be interested in reviewing in your organization, because they have the most impact. And then when we decided to look for a third vendor, we wanted to make sure that obviously was a qualified vendor. And as some of you might know, if you work with the state, we have some translation and interpretation organizations that are listed as with the state contracts. So we pull one of those vendors, and we just reach out to them and see if they could produce this quality assurance piece. We wanted to make sure that they had professional translators with relevant expertise and relevant subject matter, that they had native or near native fluency in target language. They had a deep understanding of the target audiences, and that they had also strong digital literacy and file management skills, because these initiatives also involve changing documents and making sure that they could provide us notes about the issues that they found. So the person who is doing this quality assurance has to be also well knowledge about digital literacy and understand how to use Word documents and things like that. And then also perhaps that they need to have, if they work with CAT tools, also that will be important to have for someone that was involved in the quality review process. So in this slide, I tried to put together the steps that we took for us to complete this quality assurance process. So we started, as I mentioned earlier, and I'll be sharing also a list of the materials. We started preparing the materials. So what I did is, again, go through the list of translated materials that we have performed at DMAS with our vendor, and then select the ones that we thought were going to be most impactful for our audience, to make sure that they were accurately translated. We also, when we met with the third vendor, we wanted to set clear expectations. We wanted to make sure that they had the correct instructions to work on this project, and we defined the scope. So we reached out to the vendor and we say, this is what we want to do. We have these documents. We want to make sure that linguists review it and they let us know the level of accuracy. We let them know how long they had to work on this project. We also had to inform them, because as you may know, if you work with translators, that sometimes linguists, they don't necessarily know your program. In our case, we work with Medicaid, health insurance, and sometimes linguists, they don't know about these programs. Even they also sometimes work in other countries where Medicaid doesn't exist. So we also had to define what is Medicaid and what are the programs, so that linguists, when they were reviewing our materials, they had a little bit more background about what our program was. And then we just performed the review. Once the linguist had the clear expectations on what they had to do, they performed the review. And I will share a little bit more later on how they provided us their feedback in regards their review process. And then the last step on this high-level process was to implement the changes. So if there were some issues or red flags that were raised by the linguist, we wanted to make sure that we went through all those and see what we could do in order to address if those were like very critical issues. So this is a little bit of a high-level overview of the steps that we took. And on this slide, I wanted to show you, this is basically the list of documents and the list of recordings that we provided our vendors. So I collected all the materials, and then with an Excel spreadsheet, I listed the documents that we were gonna share with the linguist so that they could review for quality. So for example, as you can see, I mean, some of these titles for documents might sound a little strange to you, but the ABD flyer is a very common flyer that we utilize here at DMAS about the aged, blind, and disabled population. It has very important information about the program. So we thought that that would be a very relevant document to have review. And we also have the adult flyer, which also has income guidelines. And for all these documents that we have listed, we listed 10 of them. We included the different translations. So for example, there is a particular IRS form that we work with. We share with our linguists the Arabic translation, but we also share the Amharic translation and the Vietnamese and Urdu translation of that form so that they could let us know if there were any issues with the translation accuracy. Other documents that we have listed here that we wore was the famous brochure, which is another program that Medicaid works all the time, and then some one-pagers. We also provided final agency decisions. As mentioned earlier, we provide translations for hearings, and when there is a final appeal decision, that if the appellant needs it translated, we also provide those translations. So we also wanted to see how those translations were done, especially like this one was translated into Amharic, and Jesus and I, we don't have any experience with Amharic, so we wanted to make sure that that translation was well done. We had other documents related to the spend down closure notices that we sent to our members. Definitely something we wanted to make sure that it was accurately translated, and also the withdrawal letter. And on the right side of the slide, we have listed here also the materials that we submitted that they were audio materials, because as I mentioned, the quality assurance entail translations, but also interpretations. At DMAS, we use phone interpretation services, and most of the time is being used for appeals hearings, and those are recorded. So we send to our third-party vendor, we send 10 recordings. All of them were approximately an hour each. And it was a recording of a hearing with the appellant and then with the interpreting services. So we want to make sure that we would get feedback about how that interpretation was being done. Some of the hearings were in Amharic, as it shows on the slide. Some were done in Korean, in Dari, Urdu, Pashto, Arabic. As you can see, a wide variety of languages, because that's the wide variety of languages that our Medicaid members speak and communicate. So we thought it was important for that. All right, so I wanted to speak a little bit about the review guidelines. This was a piece of information that we agreed with our vendor, and this was initiated for this third-party vendor. They sent us a document with instructions that they were planning to share with their linguist. As you can see from what we have described, there were different linguists, probably like 15 or 20 involved in this project, because we had so many different languages. So when the vendor was reaching out to the linguist, they were sharing with them a guideline, a comprehensive brief of what us, their client, were looking for. So we included the scope of the review, and then we also included information about the client, who we were, what programs we work for. We also share important links so that linguists, if they wanted to get a little bit more background or more information, they could access them at their own. Then we also share about our target audience and who our intended recipients are. And also we provided the linguists the step-by-step instructions, what they had to do and how they could mark if there were any issues with the translations or the interpretations. And then also if the protocol that they had to complete, if they had any questions, so they could reach out to us, the client, or they could reach out to their program manager if they had any questions about the project. And then finally, the deliverables. We wanted to make sure we were all on the same page as far as like what we needed as the final piece. And I'll be sharing with you all how that deliverable piece looked like. So the important piece of the project was to identify error categories. So it is easy for us to tell the vendor, hey, this is a document that it has been already translated. Can you tell us if it's good or if it's bad? But then the linguist and the vendor, they needed to have a little bit more of an explanation of what good translation is or bad translation is, right? So we defined different error categories, and we wanted to each linguist to tell us for each translation and each recording what type of error categories they found. So for example, we wanted to make sure that if there was an error or an issue with accuracy of the translation, for example, maybe the translation missed an important part of the original or the English source document. So if they found an issue with accuracy, they had to classify that issue as accuracy. Or maybe if they found an issue that related to different units of measurement, or maybe the address format in the translation was not displayed correctly, we wanted them to let us know that it was a local convention issue. Or perhaps it was related to the style and register or the fluency. Maybe there were issues that could be found related to grammar, or maybe awkward phrasing, or maybe the terminology, the use of the terminology was not consistent or was not accurate, or perhaps the layout, how the document looked and how the fonts display. So when we gave them the instructions, we wanted to make sure that if they found issues, that they could tell us under which category each issue was related to. We thought that that would be very helpful for us to understand. And then we also wanted them to let us know the severity level of that issue, because that was going to help us with, at the end of the project, determine what were the next steps, right? So obviously for us, we definitely needed to know if there were any critical issues with the translation or with the interpretation that was already performed, because if it was very critical, we needed to do urgent remediation actions with that material. So for critical, we also had to define what critical meant. And for us, the critical was something that fundamentally changes the meaning, impacts the safety or the legal compliance of the information that the original document says. So if it's something critical, it needs to be addressed right away. And we wanted the linguist to let us know the error severity. For major, we defined, the linguist could also let us know if it was major. For major, we define it as significantly affects the clarity and the accuracy. Is obviously not as bad as critical, but it's still something that we would need to address. And then they could also let us know if they found minor issues, like maybe small grammar or punctuation concerns that they found. Those are also important. So we also wanted to know. And also, like if there was maybe issues that they found in regards to preferential, and that goes to, maybe the differences in the word choice. Maybe the translator used a particular word and the reviewer considered that word was not as accurate or as good. So if it's something related to preference of wording, we wanted them to let us know. And lastly, if it's a repeated issue, which sometimes happens if a particular word is wrongly translated, and most likely it repeats in other parts of the text. So we also wanted to make sure that they would explain and let us know if that was a repeat issue. So after we define the task, the categories, and the critical issues, this is what we have here on the screen was the final, well, it's a screenshot of the final product that we wanted them to send back to us. And I'm gonna describe what we can see on the screen. So what we wanted to make sure is that the linguist, if they found any issues, we wanted to make sure within this table that we provided them with error location, and those are the titles of the columns, the source text, the original translation. For example, the error location, it was very important for us to know where to locate that error if they found an error. So they were supposed to include the name of the document. And as I shared earlier, we had titles on the document. So they just had to reference the title of the document and share the page if it was a multi-page document. The source text, this is, I don't know if you have been involved with validation for translations or quality assurance, but it is important when we are reviewing what issues are happening. It is very important for us, okay, what does the English say, right? If there's an issue with the translation, fine, but we want to know first what does the source text say, so that then we can evaluate how was the translation performed. So the other column is the original translation. So we wanted to make sure that the linguist, they would paste the original translation that was provided to us, right? And if there was an issue that they found, we wanted them to include the suggested translation. So these two columns are slightly different because one is how it was translated and the other explains how the linguist consider should have been translated to be accurate. And then we wanted them, as mentioned earlier, we wanted them to classify what type of category the issue that was found. And they even also had like subcategories, like for example, for the fluency category that we described before, if it was something particularly related to the grammar, they could include that. And then the column about the severity, that's where they had to tell us if it's a minor issue or if it's a major one. And again, when we receive all these deliverables, we went through first all the major issues to determine what we were gonna do next. Obviously, if we needed to remediate that translation right away, we did, right? So lastly, a very important column is the reviewer's comment. I don't know if you have experienced that, but sometimes someone can tell you, oh no, this translation is not accurate, it should say this, but if it's written in Arabic, I don't know what this is. So it is super helpful to make sure that the linguist provides an explanation, like for example, for the major issue that we have on this screen, the linguist explained phone is separated from translation. It's a fluency issue. This is 2-sentence paragraph, but divided in a wrong way and got mixed. So with that explanation, it was very helpful for us to understand the issue and then determine if it's major, if it needs to be addressed, and how we can improve that for the next one. So this is again a screenshot of one of the deliverables for one of the documents, but we had this deliverable for each of the interpretations and for each of the documents that were translated. So it was very helpful. Again, without all the instructions ahead of time and all the definitions, the linguist would not have known how to perform the deliverable that we were looking for this particular project. All right, so I wanted to highlight on this slide some tips for success to have in mind if you want to be involved in a similar quality assurance project like this in the future. We wanted to highlight to always have present a budget, and if it's something that you want to perform for translations, make sure that you add a 15 to 25% cost to your translation project if this is something that you want to do ongoing for your translations. You know, there is a cost related to that, so keep that in mind. And then also plan realistic timelines. I'm sure that everyone here has experienced that you start thinking, oh yeah, this is gonna take us 2 months, you know, 1 month to clarify instructions and the second month to implement the project. Well, things happen, and it's good to know that usually linguists and translation vendors, they typically perform translations within 1 or 2 days, but sometimes we run into issues with languages that are not as common, that perhaps the linguist is working overseas, they don't have the same time that we're here, we're closed, they are open. So having in mind and planning with enough cushion for the time, it's always very helpful. And I think this is true for any project management that you perform similar to that. This works the same way. Make sure you include ample time to complete the project, and then ensure the font compatibility. This is an issue sometimes that we have found with certain languages like Arabic and Amharic. Sometimes we don't have the fonts, or the reviewer doesn't have the fonts. So make sure that everybody has the right fonts to render properly. And then lastly, what we have already discussed, consider the reviewer availability, because as mentioned before, maybe the linguist is not available that day. So if you need to add another week to perform, that's always helpful to keep in mind. So these are some tips for success. And then as a last slide, the very important piece is, okay, so we have completed this project. So what do we do now with this information, right? This is something that came to us once we had the project completed. We had all the deliverables. The linguist did an amazing job following our instructions. What do we do with this information? Well, first of all, prioritize the critical issues. That's what I explained before, and that's what we decided to do first. So we review all the deliverables and look for any major errors that we found. and then make sure that we found a couple that we needed to revisit, and we went to the original translator or the original vendor that provided us with the translation and let them know, hey, there's an issue here, what's going on, can we get this corrected? And the same also for interpretation. We noticed that there were a few interpreters that seemed not to have, based on what was reviewed, perhaps they didn't seem to have the right vocabulary. Again, these were appeals hearings that are quite technical. So we also had some comments from linguists about interpretations that they said there were a few drops during the call, meaning that the interpreter was interpreting, but then all of a sudden the call got dropped and they didn't have an interpreter and they had to call the vendor to get another interpreter. So those were critical issues for us, and we wanted to address those with our vendor. It happens. We understand that connection issues can happen, but we wanted to make sure that the vendor was aware, since we had the recording and we also had the particular interpreter that completed that recording. That was very helpful. And the vendor was thankful that we raised those concerns because they were able to address them with their linguists. If it was a quality or an accuracy or not having the correct vocabulary, or vendor inform us that they would provide training sessions to their linguists to make sure that they would have that knowledge next time. So that was as far as prioritizing the critical issues. Then that was the share the quality assurance results is what I was just speaking to right now, about how, we reached out to our vendor and how we made sure that they addressed those issues. And then we also came into questioning, okay, we did now this quality assurance this year, but do we want to do more periodic reviews? We thought that it was going to be very relevant for the type of work that we do with translations and interpretation services. So we're going to reach out to our leadership team and propose timelines and consider if we need to put some budget aside to implement these periodic reviews and determine how often we wanted to perform these periodic reviews, because we thought that they were very, very effective and very important with the translation work that we do here at DMAS. And then lastly, just always, continuously improve this project, help us identify and create glossaries and style guides for us that we can share with linguists. So it is always, as Sarah was mentioning before, it is always constant improvement on projects and initiatives related to language and disability access, to making sure that our communications are fully and meaningfully accessible. So that was the last slide that we had. And now I just can't wait to hear from Khalil and Christina during our panel discussion. We have defined 7 or 8 questions, I think, but I want to get them on board and join me during this discussion, because I know that they have done so much work with quality assurance, and I want to hear from them how they have, or how do they implement quality assurance for their organization. So let me bring them, or like Khalil and Christina. Maybe Khalil, if you wanna start introducing yourself and providing us a little background or your agency, and then we can move to Christina and then go through the questions that we have for the discussion. So Khalil, feel free to start, and I'll pin you.
Sounds great. Thank you so much, Montserrat. And, big cheers for all of the work that you're doing. Many times during your presentation, I just wanted to cheer and, say that I second a lot of the work that you're doing. My name is Khalil Thomas. My pronouns are he, they, and I'm the Language Access Quality Specialist for the City Government of Philadelphia. We're housed in the Office of Immigrant Affairs, and our program is called Language Access Philly. We're a very small program for a very large city. We consist of myself and our director. And I oversee specifically the quality and accessibility of our services for the entire city. Everything from 911 to the libraries to the Department of Records, the quality assurance of that from the city's perspective, at least, comes to me. And I'm sure I can discuss in great detail the structure of the city and how all of that works, but I'd really like to get more into the meat of the conversation. So I'll pass it to Christina to introduce, and then I think we can get started with the discussion.
Hello, it is good morning here on the West Coast, so good morning, but good afternoon to those of you who are in the afternoon time zone. I'm Christina Bonilla Barbosa, and I use she, her, ella pronouns. I am the Language Access Program Manager at TriMet. We are a public transit agency in Portland, Oregon. We have about a little 400 square miles of service area in our district that spans across 4 different counties and within the Portland metro region. And I am fairly new to the transportation world. My background is in law enforcement and social work, but I always tell folks civil rights wherever you're at. So thank you for having me.
Thank you both for being here today. I'm sure your calendars are very busy, and I really appreciate your time. So yeah, as I said, I have a few questions. Let's start with the first one, and we can start with Khalil. So what prompted your agency to begin conducting quality assurance for translations or interpretations, and what goals were you hoping to achieve? So tell us a little bit more about that.
Sure. So I came to the city of Philadelphia in 2022 as part of a new project that was really our initial steps as a program into translation quality. That program was developed by our previous director, Maria Giraldo. And it was in response to a lot of the language access efforts that were happening during the COVID-19 pandemic. And specifically, there was a lot of public health information, a lot of emergency information that needed to be distributed to our very multilingual community very quickly. And of course, as I'm sure many of you may have experienced, there were a lot of quality issues with that. I can remember one example very explicitly, which was a poster that went out in French that said, "Help us to spread COVID-19." Just things that were all over the gambit of quality issues. And so I was brought on at that time for that temporary project. It was a project that spanned 1 year. And I was brought on because of my background in linguistics and in multilingual contact. And so at that time, really what our goal was to establish kind of a baseline standard of quality for the city of Philadelphia for our language access services. And specifically at that time, we were focused on what we call our vital services, our vital documents, and our website. So kind of the most important contact points for our community. We wanted to establish a baseline of quality. And so a large part of that was establishing what quality is and what quality means for the city of Philadelphia, and setting realistic both expectations and realistic guidelines for what that looks like.
Excellent. Thank you. How about for you, Christina? How did your agency got involved with this quality assurance?
Yeah, so I joined TriMet in November of 2023, and at that time, the agency was exploring how they can disseminate multilingual messaging across our service area regarding, any alerts or advisories or weather alerts that were needed for folks that were utilizing public transit to get to where they needed to go. And so the agency purchased a software system to help with machine translation, and quickly learned that they weren't getting the results that they wanted or were expecting from the AI translation software for a variety of different reasons. And so I was brought in to support recalibrating that project, but also working closely with community partners who worked with communities who spoke different languages and communicated language other than English to see what we can do to best support their engagement with our services. But we also really wanted to create a very welcoming environment for folks, and we knew that in doing so, we had to provide an environment or create an environment where folks felt seen, heard, validated, and could navigate our system within their capacities. And so we wanted to create an environment and a messaging strategy that was multilingual, that was for our community, not about our community. And so in doing so, we really thought about, same as Khalil, like, what is quality? What is accuracy? How do we measure that? Who gets to measure that? And when we look at a language justice lens, saying, we want to provide meaningful access as an agency, but it's meaningful to who? And so we really thought about, like, it should be meaningful to the community, and they get to determine what is accurate, what is reflective of their community, their language, their culture. And so we really wanted to make sure that we centered our communities in the process of conducting our quality assurance, but also engaging them in that process, from working with local vendors who hired local linguists to working with our community to determine neutral terminology to some of the vocabulary that communities did use or didn't use. And so again, our overall goal was to create messaging strategies and campaigns that were for our community, again, not about them, that were easily understood and navigated, and that were truly reflective of the cultural nuances and the way that folks engage in our system.
Yeah, I love that, Christina. I love the portion of getting the community involved. And as I said before, we have used linguists, but these linguists not necessarily live in our community. So they might speak the language, but they might not necessarily be involved with our programs, with our services. So getting that community involved, it's a great idea and suggestion. Thank you for bringing that up. So again, I keep hearing, and in my presentation, I introduced the definition term a lot, and it looks like it is a common terminology definition for the quality assurance project. So tell us a little bit more, how do you define quality in translation and interpretation within your agency? What does quality mean to you? Khalil, we can start.
Yeah, I think Christina kind of started to lean into some of these ideas already, right? In the city of Philadelphia, we really linked the idea of quality back to that legal mandate we have to have meaningful services, right? And so for us, we were asking a lot of these same questions, who defines quality? How do we define quality? And, something I think we may feel even a little hesitant to say sometimes is that quality is an opinion. You know, it's a point of view. There's not one explicit way to measure quality and say this is quality and that is not. And so when we started to think about defining quality, we really wanted to take a community-centered and a community-owned approach to what that meant. And especially, I have a background as a linguist. I speak several languages, but I'm a native English speaker. And so, you know, for me, there's a bit of a barrier to say that I'm an authority on what the Vietnamese speaking community here needs and what the Thai speaking community and what the Spanish speaking community needs. I can't really speak to what those communities need, even if I am familiar enough with the language to review some of the materials. And so we took the approach of working within our community as well. We held focus groups in several different languages within the community out throughout Philadelphia. And we would bring, you know, either we would bring an interpreter with them or I would conduct the focus group myself in that language. And we would bring out these different translations that came out of the city in person and ask people, okay, you know, what do you think about this? Tell me about this vocabulary. Tell me why you think this is good. Tell me why you think this is bad. And my skill as a linguist was to be able to turn that feedback, which a lot of times can be very vague. Oh, this feels weird. This doesn't sound right. And translate that into something concrete that our translators and our vendors could use to actually impact their quality. And so we've established what I call our 4 pillars of quality in the city of Philadelphia. And these are idealized to make our services meaningful, and meaningful both for the public, for the residents who are using the services, but also meaningful for us as the city government who have to rely on these services to make sure our programs are efficient and effective. And our 4 pillars are accessibility, right? Are services, you know, able to be accessed? Are they understandable? Are they working? Clarity. So is the message coming across in a way that people understand, that people can follow the directions? Accuracy, we want to make sure that 100% of the original information is getting into the translated version, right? No more, no less. And lastly, respect, right? So do our translations respect both the people who are receiving the services as well as the subject matter of the information, right? If we're writing about a vulnerable community, are we respecting that community and respecting the reader, respecting their intelligence, respecting their place in our community? One last thing I'll say before I turn it to Christina is, you know, I often stress to our vendors that we are working with quote unquote foreign languages, but we're not working with foreign people. We're working with our neighbors, we're working with our coworkers, we're working with our friends, our family, our community members. And so we're always thinking about, you know, these are people who exist in our local context, in our local social sphere, and we want to make sure that we respect that place, that they're here, that these are, you know, for the most part, Philadelphians who are using our service, even if it's in French or Haitian Creole or Arabic.
Excellent. Yeah, excellent. I love the 4 pillars and the definitions of quality for you. How about for you, Christina? How would you define quality in translation and interpretation?
Loving the synergy here with Khalil, very similar to the city of Philly. So for us, we recognize again that the word quality is subjective. And so, but we really wanted to bring in some framework around what that really means in our context and then also for our community. And so for us, we wanted to make sure that, for us, quality was information, right, or translations that are accurate, that are complete, that are culturally appropriate, and they're easy for everyone to understand. And so that really brought us to some of the same outreach and work we did in community as Khalil was, we hosted multiple focus groups to review some of our printed material with different communities in their target language. And we partnered with community-based organizations, again, that were working within those communities to remove us as a government agency out of the picture so that they could have very candid conversations about our work and our materials. That was really important to us, right? We didn't want folks to feel pressure to say everything was great just because we were sitting in the space. And then also because we didn't speak those languages, that we were hosting focus groups in. And so we wanted to make sure that the dialogue was as natural and free-flowing as possible without having interruptions. And so we did have focus groups that, some of them we audio recorded so that we can transcribe and so forth, just to make sure that we were getting an accurate representation of what was shared. We also took a step back and really thought about, when we think about quality and meaningful access, who is utilizing our service and who is dependent on our service. And so we worked our way out, and that led us to working with our school districts, with our newcomer programs, with different PTOs of different communities, ethnic communities. We worked with, English language learning programs that were in the community to really be intentional about who we reached out to and ensuring that we were reaching to those who were most adversely impacted by inaccurate translations or the lack of information in target language. And then just last, I was looking at my notes. Within the cultural context, one of the process that we initiated was we met with communities who may use language in different ways in addition to communication. And so specifically with our Vietnamese community, we have pre and post-war communities in the Vietnamese community here in Oregon in our service area. And some of the terminology that we had used in the past was inadvertently aligning us politically, which was not our intention. And so we worked with the communities to say, hey, what are some neutral terms that we could use that would be respectful and appropriate for you and for you, right? Given this is our service. So what is that we can do? How can we communicate in a way that is both neutral to both parties, and that we as an agency, we're not aligning ourselves politically with those. And so that also led into working and reaching out to other communities to say, what are the different forms of communication that you use or terminology that you use within your community? And that led to us outlining regional preferences, again, for language as well.
Excellent, excellent, excellent response. So it is very clear to me that quality, it is very hard to define and it is very subjective. But we have to produce the type of work related to making sure that it's a qualifying or qualified translation. So yeah, thank you for your insight on the definition of this important term, quality, and what it means for each of you. And I know that we have already shared some examples on focus groups, particularly for methods used, but are there any other specific methods or tools that your agency uses to review translations or interpretation services? Some examples that we have heard, peer review or back translation or bilingual staff review or client feedback. Or vendor scoring forms. Do you have any particular method that you use that you prefer? Let us know which ones. So Khalil, if you want to start.
Absolutely. We use a very kind of mixed methods approach to quality review, especially given that we have a lot of different projects and needs and audiences throughout the city. And so we rely on a lot of different things based on context. At a very broad level, we've created a standard style guide that is used by all of our translation vendors. And we also have, along with that, a standardized multilingual glossary that we developed with our community, with feedback. We had community organizations review that. And so those are both in use by all of our translation vendors. And each vendor must use those resources when producing translated material for us. They're all updated on an annual basis based on resident feedback, based on new research, based on even vendor feedback. We allow the vendors and the translators themselves to give feedback on our style guide and on our glossary. I don't claim to know everything. I think we need both the experts in the language and the experts in the community to all be in dialogue to be able to produce those tools. I also create materials for employees within the city who are responsible for using those services, whether it's on the phone, whether it's ordering a translation, things for them to be able to, for example, if I am not a Chinese speaker or I'm not a Hindi speaker or I can't read the translation that's put in front of me, what are some steps I can take beforehand, before I send off my source document to make sure I'm getting the best out of my translator possible? And then also, what are some steps I can take after my translation comes back to me? Even if I don't read the language, how can I kind of look over things and see, okay, do things look right? Do, things appear correctly on my page? And other considerations that you can take at those times. Right now, we're developing programming for multilingual city employees to be able to give additional feedback on both translation and interpretation services. Our multilingual employees are kind of like our, expertise goldmine in that they know the language and they know the community, and they, you don't stop being part of the Philadelphia community just because you have a city badge. But they also understand our institution and understand what we're trying to do, what we're trying to say, and how we're trying to sound. So we're developing resources for them to be able to do better evaluations as well. And something I'll plug here that, I'll definitely make sure I share with you, Montserrat, is a lot of the resources and things that we produce here in the city of Philadelphia, we publish under a Creative Commons license. And so this means that other organizations can take those resources, like our style guide, like some of these, resources for our city employees, and you can repurpose them and reuse them or distribute them the way you want to in your organization and in your work. We don't ask for, payment, or we're not going to come after you for copyright. We produce these for free because we want these materials to spread. And we also want you to adapt them to what's happening locally in your community. I can make decisions that I think are the right decisions for Philadelphia, but I don't live all over the country. I live right here in my community. So I encourage people to take our resources into their own organizations and institutions and practices and repurpose them and reuse them and reevaluate them with their community in mind.
Yeah, I love it. Thank you, Khalil, for your generosity. Maybe after the event, I can get that link if you feel comfortable sharing, and I have a last slide on this presentation with resources, so I'll definitely add it to these resources. But yeah, maybe I got it from your link, but it's been recent that Jesus and I we decided to create a style guide, and that it was about time. And an important section in the style guide is usually like words that cannot be translated, like sometimes acronyms. Some linguists they translate it, and some others they keep it the same. So it's so important to have that tool, as you explain, defining the terminology, defining what words need to be translated. Medicaid, for example, some linguists decide that they want to translate it, whereas other languages, they don't translate Medicaid. So we need to make it clear to all that we don't translate Medicaid. It's a proper name. So those tools are very, very helpful. And thank you for sharing that information and for sharing those tools with that link. I'm sure a lot of people in the audience will be interested in seeing those. How about for you, Christina, any particular methods or maybe tools that you use as well?
Yeah, we also use a wide variety of different tools and methods to evaluate and review our translations and our interpretation services. You know, we do use peer review. We do have community feedback loops. We also have an opportunity, space where folks can, email or call us and let us know if there's inaccurate translations anywhere in our system. I'm very hesitant to engage bilingual staff, only because we don't compensate our staff currently for bilingual skills. And so, I just want to be very cognizant and very transparent about just the emotional labor, the actual labor, and the workload and equities that engaging staff to review materials has when they're not being compensated, even when they are, right? And so recognizing that we don't compensate staff at the moment for bilingual skills, I'm very hesitant. There are some staff like, no, I want to help, like, please involve me and so forth. And so we do so when possible, specifically when we're utilizing or creating any vital documents or information. We do want to make sure that staff have the opportunity to weigh in if they choose to do so. We also do vendor scoring forms. We have a matrix in which we score our vendors based on how they certify their interpreters, the education and the experience required to be an interpreter for that agency, how often they do spot checks of their linguist and the work, and if they're, a local vendor or they're a national vendor that use local linguists. So we do have a scoring matrix that I developed that allows us to really look and see how our vendors are engaging in this process to ensure that, we're getting the most accurate translations. We don't, as an agency, certify interpreters. We rely on our vendors for that, but we do want to see how that process is for them and the experience needed to be an interpreter or, a linguist for them. We are careful about using back translations, just because if your translation isn't accurate to begin with, the back translation is going to give you an inaccurate translation unless you trained that memory to, for those word matching. We also ask our vendors who have translated material for us to allow us to download our translation memory from their software system or email us the Excel form of that so that we can compare the translation work among vendors to ensure that there's consistency in the terminology. So we created style guides in our top 5 target languages. And those style guides are in the target language and in English so that the vendor can see both. So if they may not, if they prefer not to read in English, they can read it in simplified Chinese. And then we also have our style guide and our brand guide that we share with our vendors. We're working on getting those translated as well so that they can be in target language. We also create a list of do not translate words, right? And then we also create lists of words of like, hey, if you see the word writer in Spanish, right, and it's used as a verb, use this. If it's a noun, use this, and so forth. And so do we create that framework so that folks don't have to guess, what we're trying to say, and if they're guessing, then we're not relaying the information very well in English either. We also try to do scannability to ensure that our materials are in plain language before they even go to our linguist for translation. And then again, we also do spot checks of our staff, and then we also reach out to community in different forms, feedback through like focus groups, conversations, outreach, and ask for their feedback and find ways that we can compensate community for that labor and emotional toll they're doing for us.
Excellent. Yeah. very great information. I'm writing so many notes. Yeah, like I completely agree with the glossary and the tools to make sure, like because we find it all the time too. Like sometimes we receive translations and it's letters that we send to members, and sometimes the linguists, they translate the address on the letter, and that letter has to go through the postal mail, and if we translate it into Arabic, the postmail will not know what's the correct address. So yeah, those are such important tools to have defined. So yeah, very, very thankful for this information. So the next one is about, and you have already mentioned some challenges, in particular with the bilingual staff. I also agree that they are an amazing resource because they know the program so well. But in our case too, at DMAS, if we ask them for assistance, we have to make sure, we reach out to their supervisors, and they have other functions to do and complete at the agency. So you want to make sure you don't overstep that. But yeah, are there any other challenges besides that you have encountered when trying to assess or improve translations and interpretation quality, and how have you addressed them? And we can, Khalil, yeah, if you want to start.
I'll speak to that, and one thing I'll say is I put it in the chat, but I wholeheartedly agree. Something that I have always said in our program is language skills are professional skills. Language labor is professional labor. So as part of our work in language accessibility, we've passed an administrative rule that allowed us to pay city employees $25 an hour for what are termed special projects in language access. And we work very hard to make sure that our multilingual employees, have capacity and feel respected in terms of that. I think a large thing that we've talked about is, defining quality can be very subjective. I think at the same time, it's not impossible. It's something that we do have an ability to do. And so, it's important as well for us to be the ones who make that decision. I think all of our, vendors and our different providers have quality assurance procedures, and they have quality assurance metrics. But a lot of times those don't necessarily speak to what we are talking about when we mean quality with our community. And it's not our vendors' jobs to be mind readers. It's our job to help build the bridge so that they can meet our community's needs. We have had to really create our own standards of quality and really our own mechanisms to enforce that quality. I think another challenge that we have faced is that, we are tasked with compliance to make sure, that all of our programs meet the legal requirements for language access. But we don't really have, a compliance mechanism. We're not a punishment-based program. We're a solutions-based program. And so a lot of times that takes a little bit more investigation, a little more listening, and, working with the system to be able to devise a solution. I typically tell people that 99% of people who work within the city of Philadelphia, they're helpful people. They care about our residents. They care about being efficient. They care about being effective. And so for most of them, if they could snap their fingers and a human interpreter showed up and helped them out every time they had a multilingual encounter, they probably would do it. And a lot of times what ends up being a quality service issue is somewhere along the way, there was a miscommunication, there was an issue, or, someone maybe dropped a detail. But we work very closely to kind of investigate and do, I would say, targeted interventions into things. So I'll give kind of like a case study, which was we were having a lot of trouble with getting translations into Arabic and Swahili, specifically for materials that dealt with the LGBTQ community. We were getting feedback from our vendor that translators were uncomfortable. They didn't want to, translate the material, and it was really prolonging a lot of our translation timeline. And this is a subject that I take a little bit personally, and so I was a little shocked to hear that, maybe we had some kind of prejudice or something going on with our translators. But I took a step back, took a breath, and I asked our vendor, hey, would the translators be willing to have a focus group and talk about what this issue is? And so I ended up having a focus group with several of these translators, and I asked them, hey, what's going on? Why is everyone uncomfortable to translate this material? And one of the translators spoke up, and she said, I'm an Arabic translator. I'm very professional. I've been trained in this from Egypt. I've been doing this for 20 years. I don't have any training on how to do LGBTQ topics in a way that is respectful, in a way that's going to be respectful of your culture, and in a way that it's going to make sense for your audience. And so I understand this is a sensitive topic. I understand this is something that requires extra care and expertise that I don't have. And so I choose to pass on these assignments because I want to make sure that it goes to someone who can do a good job. And several of the other translators agreed, and a light bulb went off in my head. Oh, I understand. This isn't prejudice, this is professionalism, right? This is exactly what I want in my translators for my organization is, recognition of our limitations. And so I said, okay, well, can I work with you to develop a glossary? Can I go back to the community and develop some guidelines for our style guide, and come back and see if you'll feel more comfortable engaging with these topics? And they said, oh yeah, I'd love that. I would love a glossary of terms. I would love guidance on how to approach this because I can't get that here where I live in Egypt.
Yeah.
And so we continue to make those kinds of targeted interventions. And, sometimes it's an issue with your translator. Sometimes it's an issue with graphic design. Sometimes it's an issue with the office who created the source document. We try to take each incident and identify where in that pathway the issue came up and say, okay, how can we come here and support so that it moves smoothly next time?
Wow. Very, very illustrative example. And I love that communication part, because sometimes we working with, projects in general, you just fall into assumptions, and we do the same, especially with translations. We just go back because we sometimes receive validation projects where they have to evaluate how the translation final product looks like, and sometimes they make comments but we don't understand, and we could just let it pass, but then we don't want to let it pass unless we understand why there's something wrong, and we go back. And the communication piece is so important, and the cultural aspect that you were just illustrating is so important, and finding the right solution to making them feel comfortable, translate that terminology that culturally they're not used to have in their own country. So very, very illustrative example. Thank you for showing us that challenge. How about you, Christina? Do you find any particular challenges that you would like to go over?
Yeah, sure, we've come across the same, cultural nuance challenges, identities as Khalil, but also, for us, when we when we have pushback from our vendors, right? Like we really try to understand like why is it like why do you think that, or why should we use this terminology, and how does that align with our style guide, our our brand voice, but how does that respond and relate to the community, right? So that we want to make sure again that we're refocusing our shift back to community. And so oftentimes we've had situations where the vendor may not agree with the terminology the community is using because it's grammatically incorrect. And when you enter a grammatically incorrect, sentence in our memory, our translation memory, then it's going to be incorrect moving forward, right? And that can lead to a domino effect of other issues grammatically or, so forth. Also, we, as a public agency, sometimes we're not willing to say out loud when we're wrong, right? Or when we are the problem. One of our challenges has been that, we could not support our vendors and our linguists improving translation quality and interpretation quality if we're not setting them up for success, right? If we are just giving them something and we need this back in 24 hours, there's no context, there's no source document. We work a lot on construction projects, and construction terminology is very different than medical terminology and court terminology and so forth. And, we're having, public facing information that was written by engineers, which is great. And, I understand we've all spent too much money or a lot of money learning how to write well, right? Learning how to use a thesaurus out of our brain. And I'm asking you now to, write this in plain language, right? Bring down the readability, level of this document for the community, because they're not experts in engineering. They're not experts in construction, and that's really not our target audience. And so some of the challenges that we have been facing is reminding our staff who are creating the documents or the information who the target audience is, and ensuring that it's, in plain language or easy to understand, and that it's clear. And also with that, we also learned that some of our communities may have, verbal or spoken proficiency in their native language, but their literacy levels are extremely low in their target language. And so oftentimes, as much as we want to provide written translation, if they're unable to read in their native language as well, it makes that extremely challenging. And so we've had to look at other ways to get translated information out to folks, whether it's audio, something that's screen reader friendly or whatnot. And so that's been an issue, as well as that we do have some communities also that have colloquial languages, and there's no keyboard for that language, right, that we can assess. And so how do we relay information has been a bit challenging. And then also just, ensuring that we hold our vendors to the standard, right, that we've set out in our contracts. Initially we had some issues before we created style guides and, glossaries and whatnot. And, if it's not working, it's not working. And, just being able to name that and have that candid conversations with vendors about like what's not working or what are the, reoccurring issues that we're seeing that really impact the quality of our translated materials. And then, putting that type of quality standards within the contract prior to proceeding with work with vendors. And so, it's very challenging on both ends. And then also, we as an agency haven't asked vendors, how are we like to work with? How are we as clients? How do we play in the sandbox? And really hoping that we get, feedback from our vendors about, how we are as clients for them. And that can also be very challenging, as a public agency to have egg on our face and be like, what, we could do better. So like, how do we move forward?
Yeah, very, very good point. And yeah, sometimes like for us, we try to get together with our vendor like once a year and go over what's working, what's not working, what we can do better. So yeah, that's also a challenge, making sure that the vendors do what is expected, but unless you communicate to them what you're expecting, it's not going to happen. So thank you for sharing those important challenging points that you have run into. Let me move to the next question, and we have a few more. And maybe we have gone through some of them already. How do you ensure that feedback from QA reviews leads to actual improvement in vendor performance or internal processes? I don't think we have touched on that one. For you, Khalil, how you perform that or ensure that feedback is performed back into the agency?
I think something I always stress at the very beginning of, the process is you have to encourage feedback, right? You have to make sure you're actually reaching out to your community and asking, hey, how do you feel about this? Provide avenues for them to give feedback. Sometimes I think we make it a little difficult to give feedback. And I think sometimes even institutionally, we become afraid of feedback. And I like to encourage people to take the opposite approach. I think if all language access was positive and perfect, I wouldn't have a job, right, as the quality coordinator. My job is not to make sure that there is never a quality issue again. My job is to be the person who's here and responsive and responsible when quality issues arise. And so I often tell our offices and I tell our vendors, if we're giving you more feedback, even if the feedback is negative, don't see it as a bad thing. See it as a good thing. It's an opportunity for us to improve and actually make sure the services we're offering are working and are meaningful. And then it's, after those avenues are open, really engaging with that feedback. I think all of us as people who use languages, we understand that sometimes things sound weird, sometimes a word feels wrong, sometimes a tone or something nuanced can feel disrespectful. And so my job is to show up and take us from a nuanced idea of what's wrong and turn it into something very concrete. So I can go back to our vendor and say, hey, I have a concrete, direct ask of you. I'm not going to necessarily go back to my vendor and say, hey, someone thought this web page was weird. I'll do that, if that's what's necessary for a project. But if my goal is to, create actual improvement, lasting improvement, I need to go back to my vendor and say, hey, here's a resource so that you can do better. Just like I said with our city employees, I also think all of our vendors want to do a good, meaningful job in language access. We need to give them the support that they need to be able to get there so that they feel confident in delivering us a product we're confident in.
Yeah, exactly. Thank you, Khalil. How about for you, Christina? How do you implement that feedback in your organization?
Yeah, so very similar to Khalil. One of the major differences or something that maybe that he may not shared was so I ask and download our vendors a translation memory of the work that they've done for us. And so I run those translation memories and compare them to ensure, again, that there's that consistency, accuracy, how they're utilizing terminology, and then the error rate that each have based on our community feedback, our staff feedback, or feedback from others who come across our materials. We also, try to make sure that when we are making corrections in our software, that we are tracking the edits and the reasoning behind that through our CAT tool directly into our system so that we can compare the translation quality from when we incorporated feedback to the feedback that we're continuing to get. And so we can see over a period of time if there's been any consistent errors within that like sentence or that paragraph or that information. For us, it's a bit different. I don't know if it's easier, but we're a transportation agency. There's only so many ways you can say the train's going to be late. And so, we just want to make sure that, we're doing that consistently, and it's not, where folks in a courtroom setting or a medical setting where it's really the information is dependent upon the client, that's receiving the service in that moment. And so for us, that's, just another way that we ensure that feedback is incorporated.
Yeah. It takes time to relay that feedback, but it shows that we care, right? Like if we just receive translations and we notice something is wrong, what's the point of not addressing that? Because we're going to see it happening again. And it takes time, it takes courage to perhaps share negative feedback, but it has to be done. And that shows that you care for what you're doing and you want to make sure that it's done correctly now and moving forward. Yeah, I completely agree.
Montserrat, so I just want to add to that. I also share the translation memory that I download from each vendor with all the other vendors. So everyone has the same information for us. And so they can also compare and review how our other vendor may be doing the work, because we have 4 vendors that we contract through for language services. So just wanted to plug that in as well.
That's very interesting. We usually use one vendor, but sometimes, we have thought about using additional ones, and that's such a great idea to download that memory so that other vendor can have that basis of translations. That's a very great concept. Excellent. So I know that we have a few, let me see. We have a few more questions. I think we can still fit them. So I think for number 6, so how do you balance quality assurance efforts with time and budget constraints? I think this is a very important one that I don't want to miss. I spoke a little bit in our presentation, as important tips to having to consideration budget and time, but how do you guys manage that balance in your organizations?
I'll say we definitely advocate for, setting aside resources for that practice. And in fact, I'll just be transparent. Why I have a job is because the city of Philadelphia decided to set aside some permanent resources and budgeting for that. At the same time, I also have to be very transparent, and I think transparency with your community is extremely important about our budget constraints, about our capacity constraints within our language access program. Like I said, it's only 2 people for a very large city. And so, I always say that, quality is not a destination, it's a practice. There's not ever going to be an end to quality needs in our language access services. And so I don't ever set as a goal to finalize language access quality. I think to link into what you were just saying, our goal is to be present and to respond in a solution-oriented way with integrity, with transparency when service issues arrive. And so I think there is a certain level of being honest with ourselves and honest with our community about those constraints. And what I'll also say is, because we serve our community with so much transparency, with so much integrity, we make a lot of community friends and community allies who in turn are able to advocate more for us, right? If I go to Philadelphia City Council and I say, hey, we need more money for language access, they kind of expect that the language nerd in the language access program thinks we need more money, right? But when our community comes to city council and they say, hey, we have rights to this and we'd like it expanded, it has a different impact. And so that for us is our avenue for maybe addressing some of those constraints. And at the same time, you know, we have to prioritize the work that we do and say sometimes we have a project that is a greater priority than another. And sometimes we have to be honest with our community and say, you know, hey, this is as far as we can take it, whether it's because it's out of my purview, it's out of our budget, it's not related to my office, but here's what I will do to support you and to support language access moving forward.
Yeah, excellent. Budget is always an issue with government programs, but we gotta fight for it. Yeah, especially get the public involved since it impacts them as well. How about for you, Christina, how you manage that balance with budget and quality assurance?
Yeah, we do our best, right? There's always room for improvement. You know, one of the things that we try to stress in our agency is that, you know, we have to think about translation and interpretation at the forefront of project planning, not at the end. And really ensuring that we are allocating, you know, specific budgets for translation, interpretation, and outreach. And so that we are able to see the whole scope and the cost of projects, and including that language support at the beginning and not, again, kind of as an afterthought. You know, also capacity, right? It's, you know, I am a team of one. You know, I do have some other folks on my team within my office, but the only one leading the language work. And so I tell folks, we got to move slow to move fast. And so we really, knowing that, you know, machine translation is, you know, not perfect. It is a task manager for us. Right, we've been working really hard for the last year and a half on building that memory in that machine translation software, so that now it doesn't just pull from large language models, but it filters through our style guides, our glossary of terms, our do not translate words, you know, our brand voice, our community feedback, our translated material in our webpage. And so we have really beefed up that software to help support some of our translations. For anything that's vital information or a vital document, we do have human linguists do that work. And then we do have a community feedback loop for review and provide us with that work, and that does take time. And so sometimes we are within days of something needing to go, right? Or because folks don't plan ahead, or, you know, I'm like, well, that's going to cost you more money now because now you're paying rush fees. You know, had you thought about this 3 months ago when you were drafting this poster, you know, we could have had that work done ahead of time, and, you know, several $100s less for that. And then we also have, you know, guidance for our staff. You know, most of our vendors have specific like requirements, like 200 words or more, you know. And so anything that's under 200 words that's not vital, we do run it through our software for translation. And then we do have either community members or vendors, community-based organizations that play like a consultant role for us, review that translation, and then if staff are willing to have them review it.
Yeah, I'm just so impressed the amount of work that Christina, you do with just one other person, and the same for you, Kalila. I'm not sure how many more people joins you in your unit, but it's impressive all the work that is needed and that you manage to do it. I know that we spoke in the past with the translations, automated translations that are being done, and the community involvement to review that, and it's a lot of work. So yeah, planning ahead means a lot, but also having very qualified individuals in the language access role is very important as well. Well, thank you very much. I think I'm just gonna jump into the last question, which usually I like to look into the future, right? And since we have a large audience, what practices looking ahead would you recommend to our audience that would strengthen statewide consistency in translations and interpretation quality assurance? Or what last words would you bring to the table to encourage everyone to get involved with this type of initiative, like quality assurance for translations and interpretation? What last words you guys have? And we have like 6 more minutes. See if you can keep it in a minute as last words.
Perfect. I will say, number one, events and programming like this is so important. Share, share, share. And this is one reason why the work I do in Language Access Philly is so important to me is, once upon a time, I was a little 18-year-old linguist in Linguistics 101, learning new things about language for the first time. And it frustrated me that some of those things I was learning all the way back then are still not here. And so my job is to bring them here and to share them with you. Language is my expertise, but everyone here has expertise in something, in some way, that supports the work that we're doing. I'm not the only one, and my kind of expertise is not the only kind. So I would say share, share, share. I would also say, work with your community. Your community is your biggest ally in terms of quality, and that has made all of the difference in terms of the reach of Language Access Philly here in our community. But like I said before, I can't tell everyone what to do in every community. Your community can tell you what to do in your community, and they'll be very explicit. I promise. And lastly, I would say continue to feel empowered. This is something that can feel scary and can feel like a big weight, but it's something that we're all capable of doing. And especially if we're working together, there can be no barriers to how far we can push these services. So thank you for inviting me today, and I'll pass to Christina.
Thank you, Khalil.
Great points, Khalil. Don't want to add much to that. I think Khalil did a really good job rounding that out. I would say ask for help, right? Talk to folks who are doing the work alongside you. There is a national language access network that folks can participate in. TriMet, we host and convene one regionally for the West Coast of the state of Oregon in our area. So, we just want to, be with like-minded folks. To the extent possible, share your resources, with others. We share our glossaries, our style guides, to everyone to help with that continuity of language in our region, so that we're utilizing same terminology within our areas. And know that you're not in it alone. There is an entire village behind you. And sometimes folks do want to be helpful, but we just don't know what you need from us until you ask. So
Yeah.
Thank you for having me.
Thank you. And with that last ask, I know that I've been looking at the chat. I didn't see any specific questions. Jesus, is that true? Is there any? I think we still have a few more minutes. Have you seen any questions from the audience?
Yes, Monserrat, we have some questions and some comments too.
Yeah, if you want to go just through the questions to see if we can address a few. We have a couple minutes.
Yes, I will start reading the questions in order of appearance. So the first question was from Katie Fan, and she asked if could you talk about the cost of the third vendor review?
Yeah, yeah, definitely. I think it was in the ballpark of the 3,000 or 4,000. That's the cost for our scope of work that I share with the translation to review. I think it was 10 documents of 2-3 pages each and 1 hour of hearing recordings, which total 10 hours total. So just to give you a ballpark, it was around those numbers.
Good, thank you. And Kelly Gretsch, I don't know if I am pronouncing the last name correctly. If not, I'm very sorry. And Kelly asked, why not require your vendors to provide proof of training and language proficiency on demand? And then she added that many hospital systems require these of their vendors for good reason. Random audits of vendors is ideal. And I just received a message from Kelly saying that I pronunciated her last name correctly. So I'm glad that I did it. Yes, that's her question. Why not require the vendors to provide proof of training and language proficiency on demand?
I'm not sure. Christina or Khalil?
Yeah, I can start this one off. I believe that was when I was chatting about our vendors and our scoring matrix that we have. So we do ask our vendors, for their their process of scoring, their interviewing, their qualifications, and that's why we have the matrix to rank them. Because some of our vendors, I just pulled up the matrix so I can reference it accurately. Some of the vendors require 2 years experience, right, in the industry. Some require some experience or already a certification. Some require no experience. Some require testing only. Some require, or some just say self-identification as bilingual, right? And that's independent of the court certified interpreters and medical interpreters, right? So we do have like a nonprofit here in Oregon, Pueblo Unido, who is working with the court and the medical field here to provide some form of certification for indigenous languages of Central and South America, and creating that framework and providing training for those folks. So we do require that, but again, we're also relying on the vendors to do their own screening and background work to ensure that their linguists are who they say they are and have the level of skills that they say they do. Oftentimes that's not an issue, and oftentimes it's very obvious that maybe one of their linguists used Google Translate and sent over the document. So hopefully that answered the question.
Excellent, Christina. And I know, Jesus, I know there's a few more questions you mentioned that we have, but what we'll have to do, because we have passed the 3 o'clock, we'll just put them together and then reach out to our panelists for their answers, and we will be sharing that with the audience. So thank you everyone for being here today. A special thank you to Khalil and Christina for all the knowledge that you have shared. Again, we're all on the same boat. We're all trying to learn from each other. I've never been in such an amazing community where we all support everyone with all what we do in regards to language and disability access. Thank you, Jesus, for helping out with the technical and questions. And thank you, Sarah, for your amazing opening keynotes. And thank you, the audience. Thank you, everyone, for joining us. It shows us that there's so much interest out there about language and disability access programs, and it makes me happy that everyone wants to learn something new. I appreciate everybody's time, and we'll be in touch. I'll be sharing the recording and the presentation and the answers to the questions that we haven't been able to address. Thank you for the ASL interpreters also, and the person that is transcribing. Thank you so much. Have a wonderful afternoon.